Hi, this video is about how to tell if your MRI images included the coccyx or tailbone. This is important if you have tailbone pain and if your doctor sent you for an MRI as part of the workup or testing being done for the tailbone pain. You want to know, did the MRI actually include the tailbone in the first place? It seems simple, but let me tell you, a lot of times it doesn't get included. I'm Dr. Patrick Foy. I'm an MD or medical doctor, and I specialize in pain management, and I'm an associate professor of physical medicine and rehabilitation. I'm also the director of the Coccyx Pain Service at a large medical university on the eastern coast of the United States. And my website is tailbonedoctor.com. First of all, we should review some of the basic anatomy. This is a plastic model of the lumbosacral spine and coccyx, and this area here is called the lumbar spine. This would be the area from where the ribs end, up above, to the start of the back of the pelvis, the start of the sacrum. This would be at about the belt line, if you were wearing a belt, just for reference. So this is the lumbar spine. The next section down is the sacrum. The sacrum is 5 bones typically that are fused together that make up the back of the pelvis. Together, these two areas make up the lumbosacral spine. Just realize that the lumbosacral spine does not include the next section, which is the coccyx. The coccyx is way down here. And that becomes important because if you have a lumbar MRI or a lumbosacral MRI, typically it will not include the coccyx. It will not be included. So what can you do if you're a patient? Well, first of all, one of the things that you can do is read the orders, read the radiology orders that your doctor has written. Because low back pain in the lumbar or lumbosacral area is so common, a lot of the check-off boxes and templates that doctors use to order MRI forms, or what they're accustomed to writing out, is to get a lumbar or lumbosacral MRI. And those may be terrific for lots of patients with low back pain up at about the belt line, but if your pain is all the way down at the tailbone, it probably will not get included in that image. So what you really want to do is look at the orders. Did the doctor order a lumbosacral MRI or lumbar MRI, or did he or she actually know to order an MRI that included specifically the coccyx? The other thing you can do if you've already had your MRI done and maybe you've been told that it's normal or there was nothing wrong, get a copy of the radiology report. Your doctor's office can easily provide you with this. They can make a photocopy and mail it to you or give it to you during your follow-up visit. And you want to look over the report carefully for yourself. Look through the text of the report and see, did the radiologist even mention the coccyx or tailbone? If he or she didn't mention it, there's a good chance that the reason is because perhaps the coccyx wasn't included at all on those images. So really you want to take a close look at that. The other thing you can do is to actually get a copy of the images to look at yourself or to look at with your doctor. Usually an MRI facility will be able to either burn the images onto a CD for you or give you the actual printed images that they can loan you, and you can either look at them at home or you can, better yet, take them with you to your doctor's visit and specifically ask your doctor if he or she can point to the coccyx on some of the images so that you can actually see where the coccyx is included. And be prepared to be surprised because it's very common that the coccyx won't be included at all. Even though perhaps you and your doctor thought that the reason the MRI was being done was because of the coccyx, and of course it would be included, and of course the radiologist would have commented on it. You may find that not only is it not mentioned in the radiology report, but it's not in any of the images either. And it's really unfortunate, but it happens all the time. I see hundreds of patients every year for coccyx pain or tailbone pain, and it is very, very common that patients have been told, everything's fine, there's nothing wrong with your spine, the MRI looked perfectly fine, and really what it turns out is that the MRI did not even include the area where the patient was having their pain down at the coccyx. So really, hopefully by taking those steps, by looking carefully at the radiology orders, the MRI orders, by looking carefully at the official radiologist's report, the typed up report, and by looking at the actual images, you and your doctor can make sure that if you're having an MRI done because of tailbone pain, that it should of course actually include the tailbone. If you want, you can look at more images of tailbone MRIs at our website, which is www.tailbonedoctor.com. Okay, just a couple of quick warnings and disclaimers. These videos, of course, are meant for educational purposes. They're not meant to be specific medical advice. really for specific medical advice, you would need to be seen in person by a physician or other healthcare provider. Also realize that tailbone pain can have some very serious causes. So not only things like fractures and dislocations, but sometimes even things like cancer, malignancy, underlying infections. And again, you owe it to yourself to be evaluated in person if you're suffering with tailbone pain. Also realize that tailbone pain, coccyx pain, is relatively uncommon, and many doctors might not be familiar with the currently available means of evaluating for tailbone pain and also treating it. So you really owe it to yourself to see a specialist who has particular expertise or experience in treating tailbone pain. For more information, feel free to go to the website www.tailbonedoctor.com. Thank you.